Hello, everybody. I am Dr. Alejandro Mendez. Greetings from Mexico. And I really appreciate this opportunity to talk about this topic that really fascinates me. I'm going to be going through the comprehensive dental management of cleft lip and palate. Let's jump straight in. Comprehensive dental management of cleft lip and palate. This boy has a cleft lip palate. In this case, he has a complete bilateral cleft. As you can see, the cleft involves the lip, the alveolar ridge, right here where the teeth grow, and the palate, obviously. For this baby boy, the complexity of the problem not just requires an immediate surgery, but a long-term treatment in different specific areas, such as the speech therapy, psychology support, and nutrition due to the suction and feeding problems that lead to underweight in these kids. Besides, this type of patients will cope at some point with some problems regarding bullying. This is not just a long-term treatment, but a very expensive one. Luis Treserra, a Spanish surgeon, defines cleft lip palate as a congenital condition consisting in an open section at the roof of the mouth that affects the mouth and the nasal cavity. Children with CLP might experience functional problems related to speech disorders mainly. By the 4th and the 6th weeks of embryology development, the medial and lateral nasal processes take place, as well as the maxillary one. The medial nasal processes will fuse with the maxillary processes. Although the etiology of the interruption of the development is still unknown, the cleft is formed during these weeks and continues until week 12 when the palate is formed. In this bilateral case, the bilateral cleft occurs during the same weeks of formation. So a cleft is formed in both sides of nostrils, so that phase affected the whole complete palate. The complete cleft goes from the nose to all the way back down to the back of the velum. Clearly, the lip will be affected too, right? Worldwide, one child out of 700 is born with a cleft lip palate. Here in Mexico, the average is 1 out of 640. That means that the incidence rate is bigger. While the prevalence of cleft lip palate worldwide is around 46%, in Mexico we have a 70% incidence. For every 2 male cases, there is 1 female affected with this pathology. Although the etiology is unknown, there are some multifactorial aspects that could trigger this problem, such as defective genes, environmental factors such as the use of pesticides where these kids are born, radiation due to the treatment during pregnancy along the 4th and the 6th weeks, pollutant chemical agents such as food or drugs, or some mechanical features like the hemifacial microsomia, which can be caused by a vascular problem leading to poor blood supply to the fetus. As we already mentioned, there are really hard complications regarding feeding, oral suction, the periplastic movements are inadequate or not existent. So they can swallow properly, which leads to growth impairment in these kids. These patients are more prone to breathing problems, ear infections, otitis media, which is also called glue ear, They can also present speech problems and emotional implications during the childhood and adolescence. In some particular cases, this can induce to suicidal feelings. This is a long-term treatment that should aim at achieving 5 goals. Medical assessment regarding a functional cosmetic repair of the face and lips, suitable orthopedics right before and after the surgery, a fitting odontology treatment, speech therapy, and overall, the psychological support first to the family and then to the patient. An early stage treatment during the first and second weeks of the newborn patients with CLP is crucial. This ensures a better balance between the different systems involved, mainly the muscular, dental, and skeletal system. This balance will provide the correct growing of the maxillary as normal as any other kid without this condition. Regarding the surgical aspects, there are 3 stages. The pre-surgical stage, the surgical stage consisting of 5 surgical procedures, the lip repair, palatal repair, alveolar bone grafts, plastic surgery, rhinoplastic, or the orthodontic repair. And the post-surgical stage covers 4 main areas that are covering odontology aspects like cavities control, orthopedics, orthodontics, and periodontics. It is important to mention that could be a post-surgical treatment without a surgical intervention. So that means that there is a lip repair, but not a palatal repair intervention in the child because he doesn't or she doesn't suffer from this problem. However, the surgical treatment should be carried out in a very specific plan. The placement of an obturator that fills the palatal cleft and allows a better fitting is very suitable in this first stage of the newborn. And the second one is a palatal plate that provides maxillary cross stability, preventing arch from collapsing and ensures the surgery success. The aim is to prevent block and correct dental facial anomalies and to stimulate the osseo-alveolar area using these devices. An initial assessment ensures a better use of the tissues in the lip and the palatal areas. Concerning the surgery, there is a chronological scheme to follow. So the cleft lip repair should be done at the first 3 months. The palate repair should be done on the 9 to 12 months. The alveolar bone graft, which is closely related to the canine growth, takes place during 7 or 9 years old. Then we have could be a surgery repair, an orthodontic surgery, or osteognatic destruction. Here are some patients who had different surgical lip techniques. The first girl presents a surgery called Fisher. The second girl has a surgery called Ascencio del Valle. The third one has a surgery called Millard. And the fourth one has a surgery called Pennington Randall. Their effectiveness depends on each case and is determined by the type of cleft. So for the palatoplasty, the most common procedures are bone warding and bone Langenbend. The forelock palatoplasty applies specifically to the repair of the soft palate and to the reconstruction of the levator muscle sling. The palate repair can be accomplished using bone transplants from the calloram, rib, tibia, fibula, the iliac, and the mandibular bones. The amount of graft depends on each particular case, as well as the surgeon's skills. And also the zone to access to this bone has to be easy to obtain. In this case, the alveolar bone was filled using the mandibular symphysis graft. so the living bone can grow, providing a better framework. Here are some examples of orthognathic surgery, osteonic distraction, and rhinoplastic. This guy over here has a pseudoprognatism as the result of a maxillary hypoplasia. So an orthognatic surgery was carried out. Here is the before and after the surgery. As you notice, there is a more defined and symmetric appearance. This girl who received the bone graft wore an external distraction device to lengthen the maxillomandibular bone. The bone lengthened around 12 millimeters. This girl had a rhinoplasty. The tip of the nose was reshaped, and there is an improvement on the uneven appearance of the nostrils as well as the space along the philtrum to provide a better symmetry of the nose. Regarding the post-surgical stage, regular dental care is necessary to avoid cavities problem. The orthopedic works The orthopedic work takes place by the use of palatal expanders to avoid its collapse, or by the use of some external devices to lift up the nostrils, like in this case, after the surgery, in order to avoid the rhinoplasty eventually. It is also important to use some orthodontic appliances to correct any related problems. In this case, the patient also suffers from receding gums, so a periodontal treatment will also be necessary here. Regarding the pre-surgical orthopedics, this is one of our study cases looking forward to improve the functional surgery stage. We observed this girl with an obturator and a cleft of 8 millimeters approximately, which is like 0.3 inches. So to reduce the size of the cleft gap, the use of some oral strapping across the face were employed. The nasal conformator allows the closing using the buccinator muscle strength. The aim is to narrow the cleft as much as possible. So we have some impressions of the gap. So the second one shows a post-surgical lip repair right before the surgical palatal repair. So we found out that the alveolar arch was narrowed around 5 millimeters. 3 years after, this girl shows an optimal aesthetic and functional condition. In this case, we see a photo of this boy right before the lip repair. And the second photo was taken some weeks ago. As you notice, there is an extreme change between both images. In this image, the cleft gap in the palatal area was still quite wide after the lip repair. After the palate repair, an orthopedic treatment was used with maxillary expanders. Here are some initial impressions. As you notice, the cleft gap was approximately 5 millimeters width. After the lip repair surgery, the cleft is basically closed and the back is aligned. After the palatal repair, the alveolar shape looks really acceptable. To conclude, the cleft lip callus is the most common craniofacial malformation. It requires a multidisciplinary treatment. An integral management should be carried out during the childhood and adolescence. Pre-surgical orthopedic treatment improves the outcomes of the surgery during the early weeks. When the cleft gap is narrow, the post-surgical treatment becomes less demanding. It is not the same 3 millimeters gap than 15 millimeters gap. So it results more convenient, not just for the surgeon, but for the adequate recovery of the patient. The post-surgical treatment is always crucial. So an accurate integral management